Hello and welcome to the 6 overlooked causes of hypothyroidism and Hashimoto's. My name is Dr. Stephen Irvine. I am a chiropractic physician who is also certified in functional medicine.
Here's a picture of my family. We almost didn't have a child. My wife ended up getting diagnosed with Hashimoto's hypothyroidism by her OB/GYN. So we ended up having her go on Armour Thyroid, and we were able to have a child. That's pretty much the reason why we're doing these lectures, because it hit home for our family. My mom actually also has Hashimoto's hypothyroidism. My mother-in-law has hypothyroidism. My sister-in-law has Hashimoto's hypothyroidism. So this is becoming the new normal.
This workshop will not change your life unless you make good choices in your life. That includes diet, lifestyle, and environment. This picture is a beautiful river, and if you had a house next to this river and got to enjoy it, and one day you woke up and there was toxic waste in it, what would you do? Would you build a toxic waste removal plant next to the river, or would you go upstream to figure out where the toxic waste was coming from? And that's exactly what we do in our practice. We try to go upstream and find the root cause of what's going on with your issues. So today's agenda is basically a whole new approach to health. We get this question a lot. My thyroid tests came back negative, but after reading symptoms of thyroid, I think I have some like weight gain, losing lots of hair, and my hair is very dry. I have sleep apnea, I have strange feelings or tightness in my neck, and forgetfulness. Why this matters. Thyroid cancer is the fastest growing cancer in the United States. Women account for about 75% of cases, but we are starting to see now men come into the office with Hashimoto's hypothyroidism. 98% 5-year survival rate for all thyroid cancer patients, and nearly 66% of cases are people between 20 and 55 years of age. So how do we identify this process before it turns into a more severe problem? Well, what we look for is the systems of the body and which systems are having issues. The thyroid can affect the throat. You can have difficulty swallowing, enlarged thyroid gland, hoarseness of the voice, and even sometimes feel cysts. The brain usually is consistent with foggy thinking, low motivation, depression, anxiety, fatigue, hard time dealing with stress. The heart, you'll feel that your heart rate is either getting faster or slower. Sometimes you have flutters or palpitations. Carpal tunnel syndrome is affected with thyroid issues. The sex organs, especially for women, there's menstrual problems, polycystic ovary syndrome, low libido, infertility, and frequent miscarriages. The legs typically will have edema and swelling in them with a spider and varicose veins also. Digestion is a huge complaint, especially when there's low thyroid. You have constipation issues, bloating, gas, pain in the stomach because of low stomach acid production, which could lead to a SIBO infection also. The gallstones are a pretty big problem, and liver dysfunction. So what you will receive today, you'll learn a new highly effective approach to thyroid problems. You'll learn to ask the right questions. You'll leave with actionable steps to improve your health and a special opportunity to explore all your options. These are 3 hormone body types that we see. The red woman is an adrenal body shape. The green woman is a ovarian shape, and the blue female is a thyroid shape. Now these shapes aren't set in stone. You can have mixtures of 1, 2, or all 3 of them. This is a progressive change in body composition. This is the thyroid shape and how the body puts on weight. And as you can see, a thyroid body shape gains weight everywhere. The thyroid hormone pathway. So the hypothalamus talks to the pituitary talks to the thyroid by the way of TSH, thyroid stimulating hormone, which a lot of people see on their blood labs when it's done. And that thyroid will push out T4 and T3. Now the T4 goes to the left and ends up going into the liver and kidney and gut. And this is where you basically either make reverse T3 or regular T3. Now, the good T3 actually runs the mitochondria and the cells in the body. The thyroid will also produce about 5% of the T3 in an active form. So you can either go from T4 and convert it to T3, or you can get the T3 directly from the thyroid. I usually like to explain this as basically, if you think about this, if your employer paid you $100 and he gave it to you $95 in a check form and $5 in a cash form, the $5 cash form you'll be able to use instantly. But the $95 in the check form, you would have to go to the bank and deposit, and then you'd be able to pull out what you needed. And in this instance, it only gets used and able to be processed is if your liver, kidney, and gut is healthy. And then the T3, either from the T4 conversion to the T3 or directly from the thyroid, ends up going into the nucleus of the cell, of every cell in your body. So we're going to talk about chronic stress. And with chronic stress, we can definitely go over the symptoms of adrenal fatigue. Feeling tired in the morning, even with enough sleep. It's the typical person that hits their snooze button in the morning. Waking up in the middle of the night between 2 and 4 a.m. Low libido and motivation. Craving for sugar, salt, or fat. You get tired between 2 and 4 p.m. You need some caffeine to keep going, or you'd like to take a nap around that time. Irritable if meals are skipped, so you have unstable blood sugar. You got stubborn belly fat. You have a poor exercise response, and this being you're exhausted after you get done working out, or maybe you have a headache upon maybe interval training when you stress your body out. Mental confusion and lack of focus. Poor immune health and recovery from colds or illness. The typical person that catches every single cold in the winter, or it's the cold that hangs on for a long period of time. Poor digestive dysfunction, anxiety and depression, dizziness when you stand up quickly, feeling tired and wired. Now, we hear this a lot where people will come in and they will say that they're exhausted but they can't fall asleep. And the inability to handle stress and sensitivities to sounds, light, and pain. This is an important pathway. Light, sleep, and immune health is what it's titled. This is a pathway for two hormones, melatonin and cortisol. And if you look at these, they're in an inverse relationship. When the cortisol is high between 6 a.m. to 6 p.m., the melatonin is low. Now, melatonin allows you to go to sleep. So it's all based off of the sun or lights in your house. And at around 6 p.m., the cortisol should be decreasing and the melatonin begins to rise. And from 6 p.m. to 6 a.m., the melatonin is what keeps you asleep. So if the cortisol stays elevated after 6 p.m., you won't be able to sleep. That's your wired and tired individual. If the melatonin ends up kicking on, then you'll be able to fall asleep and stay asleep. Now, some of the things that you can do, if you have an Apple phone, you can turn the night shift button on. And the night shift button you can set from sun up to sundown. And when the sun goes down, it automatically will put an amber light on your screen. Now, the reason I tell you this is if the amber light isn't on the screen and you're looking at that blue light, that actually revs up your cortisol and decreases melatonin production. So typically a good rule of thumb is to turn off your phone about 2 hours before you go to sleep. And that goes for even your LED or LCD TVs, looking at monitor screens. If you really want to do that, what you could do is get the blue light blocking glasses. You can find those on Amazon. And when the sun goes down, put your blue light blocking glasses on. I know they're starting to put films on regular glasses, but that can prevent you from getting revved up from that blue light, which isn't very good for us. Stealth infections. So when we do any type of autoimmune or Hashimoto's, we always do a stool analysis on patients. And what we like to see is if there's any type of pathogens in the body that could be affecting the body by producing toxins, or maybe if there's yeast in there. Yeast actually is one of the precursors for Hashimoto's. So if there's a high yeast, there is a component that if there's yeast in the body, it will create a Hashimoto's event. Nutrient depletion. This is quite common. Sometimes when people's digestion, or if they have leaky gut or a SIBO infection, they don't get the vitamins that they need or minerals. So if we don't get the vitamins and minerals, you can kind of see that that is what the factors that contribute to proper production of thyroid hormones. You need nutrients like iron, iodine, tyrosine, zinc, selenium, vitamin E, B2, B3, B6, vitamin C, and vitamin D. Now, this isn't a recommendation to run out and get all these supplements and minerals. We usually test to see which ones are needed. Here's the factors that increase conversion of T4 to reverse T3: stress, trauma, a low-calorie diet, inflammation, toxins, infections, liver kidney dysfunction, and certain medications will block that conversion. If we go to the top right, factors that inhibit proper production of thyroid hormones, you have stress, infection, trauma, radiation, medications, uh, fluoride, which is an antagonist to iodine, and also chlorine and bromide. Toxins, pesticides, mercury, cadmium, and lead, and autoimmune disease like celiac. What they are starting to find is that wheat affects the thyroid gland, and a lot of functional med practitioners and providers are recommending their patients stay away from wheat and most grains. Factors that can increase conversion of T4 to T3 are selenium and zinc. And factors that improve cellular sensitivity to thyroid hormones is vitamin A, exercise, and zinc. Mitochondrial dysfunction is a large problem, especially when there's autoimmune diseases or Hashimoto's. The mitochondria are the kidney-shaped structures in this cell. The thyroid hormone actually hits the outside of the cell. It's brought into the nucleus. The nucleus tells the mitochondria how much energy to make, and this determines what your metabolism is going to be in your body. This is an organic acid test that we like to run on patients. It tests fatty acid metabolism, carbohydrate metabolism, energy production, and then in the energy production, it's showing the Krebs cycle. And the Krebs cycle will determine how much ATP or energy is produced by every cell in your body. So in this patient, we ended up seeing that she had fatty acid metabolism, which means she was having a hard time taking fatty acids and using them as energy. So there was no conversion. So this patient had a very hard time burning fat. She also had some carbohydrate issues, so she couldn't break down her sugars. And she, like I said, she did have some energy production issues. So she basically couldn't even she couldn't break down and use the components, the fatty acids or the carbohydrate, to make energy, and then she couldn't use those components to put into the Krebs cycle to try to make energy. So the takeaway message here is, in order for your medication to work, your body must work first. So here's the thyroid fact. 90% of the hypothyroidism is caused by Hashimoto's thyroiditis, an autoimmune condition. So in this situation, your thyroid is merely a victim. The hidden dangers of autoimmunity. I'm going to show you an image here. It may make you sick or dizzy, and this is a very gross way of checking for cerebellar ataxia. And what it's caused by is the immune cells destroying your cerebellum, which is common with Hashimoto's. 47% of people with one autoimmune disease have another one that is undiagnosed. And you can take a look at this picture. And if it makes you dizzy, look away. So when you have one autoimmune condition, you likely have another, and it's just kind of hiding. This is a Cyrex lab that we like to do on some patients if we suspect that there's multiple things going on, and it checks multiple systems of the body for another autoimmunity that could be present. So the take-home message, the presence of one autoimmune disease may indicate others, and that's the reason why you want to get tested and be proactive about this, because polyautoimmunity does happen. We have many patients in our office that have multiple autoimmune diseases because the triggers are still in place. And what you have to do is you have to find the triggers that had caused your immune system to malfunction. Food and chemical sensitivities. Here's a sample of a food allergy test. And with this patient, you can see that there was multiple things that showed. Casein, which is dairy, oats showed, coffee, sesame, sorghum, teff, and egg. And typically for a Hashimoto's or a thyroid patient, we usually tell people no grains or no dairy. Those are two of probably the most highly inflammatory groups of foods that you can eat. So we're going to go over leaky gut syndrome, which there's a lot of information on, especially if you start going on the internet. You can find all sorts of stuff on leaky gut. Another name, the medical term is intestinal permeability. So leaky gut syndrome. This is a white picket fence, and one of the white pickets is removed. And if you think, for example, if there was a dog that was in this person's yard, and it was the owner's dog, and he was running around the yard, but this picket's knocked out, what would happen? The dog possibly could get out through this hole and end up in your neighbor's yard. And it could dig a hole or go to the bathroom. And basically, the dog is where it's not supposed to be. It should be contained in your yard, and that's similar to leaky gut syndrome. So in this picture, these are the intestinal epithelial cells of the bowel. The green, red, blue, and light green bonds are basically what allows food to go through and be absorbed into your bloodstream. Now, if the intestinal epithelial cells are damaged or inflamed from a poor diet or from pathogens such as bacteria, yeast, or parasites, and that barrier gets broken down, then you have stuff that is not supposed to be going through the epithelial cells and ending up in the bloodstream. Therefore, you have leaky gut. Most of the time, it's pathogens or maybe undigested food particles that are too large to even be in there, but with those bonds broken, they have no problem actually getting into the bloodstream, which causes an immune reaction. Those bonds are actually controlled by vitamin D, which controls the calcium in the intestinal epithelial cells. So which gut is healthier? On the left, you have the villi, and that's what they're supposed to look like, and on the right, that would be a celiac case. So the villi are pretty much destroyed, and you can kind of look at these pictures and determine that if a person was eating food, which one would actually be able to digest it and absorb it properly. It definitely would be A. So here's a pathogen, and if the intestinal epithelial cell is damaged, that pathogen can go right in where it's not supposed to be. You can always check for bowel transit time. This is just basically to tell whether you are able to process your food and get it out in a allotted time that is acceptable, typically around anywhere from 24 to 36 hours. So if you wanted, swallow a pine nut and see how long it takes. Timeline of autoimmune progression. A lot of people end up having triggers, and the triggers are allergy, a virus or an infection, or even maybe some stress. Another thing that can cause issues, especially with Hashimoto's or hypothyroidism, is hormonal changes. So we see a lot of hypothyroid and Hashimoto's around pregnancy, after pregnancy, and before menopause, and after menopause. Those time periods can be a trigger for Hashimoto's disease. So a lot of people will have these triggers and they don't think much of it, but they can go for a while before it actually becomes a symptomatic phase, and that's the dynamic symptom threshold. So basically, you can have a trigger, and a couple years later, you can have a symptomatic phase, and then you realize that you have a thyroid issue. And this is typical for all autoimmune diseases. It just takes a little bit. But the triggers is what we want to go back and actually clear out so you don't get into a polyautoimmune position. So what you need to do is you got to make good choices with your food. You got to be able to exercise. You need to have positive coaching, and you have to be able to balance your stress and have good relationships in your life. I always tell people have good relationships because if you have a toxic relationship, they are actually finding out that that causes inflammation in the body. So what it takes to make change, first you have to be frustrated. And that's probably why you're listening to this video. You have to be motivated. You have to be able to make an investment in yourself. You have to have accountability. That's what we do. We're basically accountability coaches. And you have to have a long-term approach to figure out the labs and the approach and what you need to do to get healthier. So functional and lifestyle medicine, it's time for a smarter approach. So what is it? And this is how we usually like to talk about functional and lifestyle medicine. All these words that you see here, you have cancer, insomnia, thyroid disorders, all these are labels. And what functional medicine does is just increase the function. And what we look at is inflammation, poor diet, a lack of purpose, toxic relationships, a sedentary lifestyle, low nutrient status, genetics, environment, and poor self-image. And the poor self-image, if you have a poor self-image of yourself, you won't think that you're worth actually doing the work or paying the money to get better. We always tend to say if you had $1 million racehorse, what are you going to feed it? And it would be really good food. You're not going to feed $1 million racehorse Skittles. I don't think it would do very well. Not to mention that would create a lot of inflammation in the body because sugar causes a lot of inflammation. So the poor diet, you have to eat a really, really clean diet. We usually in our office will push a Mediterranean diet, a keto diet, or a paleo diet, or a paleo AIP diet. Like I said, toxic relationships is a large problem. A sedentary lifestyle, I think you've kind of heard the sitting is the new smoking. I read something just recently where they said sitting for a day takes 2 days off your life. Low nutrient status, that can either be from poor diet, it could be from not absorbing properly, it could be from infections in the bowel, like a SIBO infection. A whole bunch of stuff can cause low nutrient status. And then you get into genetics, which is a whole conversation in itself. And a poor environment. That's the hardest thing to work with. I mean, you have to have clean air, clean water to have a good environment. So these are the 6 overlooked causes, and this is what we usually we go after. We increase function, the mitochondria are, where energy production is, detoxification and oxidation, brain health and methylation. We look at diet and digestion, stress and inflammation, lifestyle and environment. And if you clean up these 6 overlooked causes at the bottom of the pyramid, the cellular health of the person will get better. And if the cellular health gets better, then the organ health gets better. And when the organ health gets better, the systems of the body get better. And then your state of health increases. So this is merely functional medicine. It's basically increasing function on a cellular level. And these are some of the things that we've worked with in our office. So begin with the end in mind, your desired state. What do you want? I always say people want to be energetic. They want to be motivated. They want good clarity. They want to be happy. They want to be calm, confident. And the current state is tired, unmotivated, foggy, depressed, stressed out, low self-esteem. And how do you get there? It's one step at a time. And this is a rather long journey, but the journey is worth it. And people do feel better. And I see a lot of changes that happen in people's lives. But this isn't quick. This isn't a quick fix. It's not just take a pill and you feel better. You have to put the work in. You are the doctor of the future. The patient has the power. We're just merely the coaches. And I always tell patients this, it's 80-20. It's 80% you and 20% me. So, do you now see why it's important to get to the root cause? Why it might not be your thyroid? It's probably your immune system. Why doing the right testing is important? And that was with the organic acids, with the stool testing, with the polyautoimmune test. There's a whole bunch of tests, and we determine what test is right for you and which tests will benefit you. Why you can never fix a thyroid condition with just medication. If the system isn't working properly, the medication is different in how it works for every single person, and why the current approach is failing so many people. See, what we do is a personalized, individualized plan just for you. That's why it's a personalized healthcare solution. When we switch over to a personalized healthcare solution in America, we will have a healthier America. So, finally, our comprehensive program connects all the dots together instead of creating more confusion. It looks for the root causes from a biochemical, emotional, and environmental perspective. It uses state of the art lab testing to find hidden issues. And it teaches you a life skill that you can pass on for generations to come. So, my personal invitation to you, I invite you to come to our office for a thyroid discovery session. During this 60-minute session, you will receive an opportunity for your story to be heard, a thorough evaluation of your blood work and intake form, and our intake form is, I think, 46 pages long currently. And we get to go over any type of blood work that you bring in or any other functional med testing that you may have had, a thorough evaluation and assessment of your blind spots, and a chance to sit down with someone who values your health. So, if you would like to come in, this is our address. I left our Facebook information on here and our website. Please give us a call if you're interested in taking an advantage of coming in and sitting down and talking to us about your health. And thank you for listening.